My name is Ashley Barnes.
And you are a nurse?
I am a registered nurse, have been for going on 13 years, and I worked the ER during the start and height of COVID, and I also traveled as a nurse in various ERs during COVID as well.
Okay. Wow, we've got a lot of questions for you.
Okay.
Right. Why don't you start with telling us what you saw as a nurse in those days?
So at the beginning of COVID, like everybody, we're a little on edge. Like, what is this virus? What's going on? But I will say, before COVID even became a thing, back in November of 19, we had a weird respiratory season. Normally bronchitis is something that's very prominent during that time, right before Christmas, and then flu usually comes in pretty heavy. But we were seeing a respiratory virus that we couldn't diagnose as COVID. We couldn't diagnose as bronchitis. We couldn't diagnose as flu. It was a cough, a lot of the very similar COVID symptoms everybody was having during the height of COVID. But then COVID came, and at the beginning we saw nobody because everybody was scared to come to us. Then once we started seeing it, the hospital protocols coming out along with it just didn't make sense. Anybody could just wear whatever they wanted to on their face. Wait, I'm sorry, can I start over? Oh, I'm so sorry, I apologize. We were told, we couldn't step into without a mask. We couldn't step into a room without full body coverage. But people really weren't as sick as what they were telling, the media was saying that they were. Our local hospital put out a morgue truck that never got used.
What do you mean?
So they had a morgue truck come in and parked it in front of the hospital.
For photographs?
Yes. Invited major news channels in, and all of our local news and media were covering this. And they were saying, we are running out of space in our morgues to put bodies. So they had to have a morgue truck. That morgue truck never got used. Never was once used. So the fear tactics, like everywhere, were being really heavily pushed by our local hospital system. I lost a lot of respect for my coworkers and physicians that I have worked with for 10 plus years. All of a sudden, it was, if people weren't wearing masks, why should we treat them? If they're not going to do anything to protect themselves, then why would we treat them? And that didn't make sense to me, because for one, you could put anything on your face and call it a mask. That's not doing anything for you anyways. But I asked people, I was like, well, are you going to stop treating the person who's ODing, the addicted person who's going to OD for the 10th time when he comes in? Are you going to stop treating them because they're still doing drugs? Are you going to stop treating the COPD patient who still smokes 2 packs a day? Are you going to stop treating the diabetic patient who doesn't take their insulin like they're supposed to and still, doesn't manage their dietary nutritional needs the way they're supposed to? And the answer was no. Then why would we not treat somebody who's not wearing a mask? Then it came to, well, they should have been vaccinated. And then as a nurse who's proudly unvaccinated, I was bullied by my coworkers for, you're smarter than this. Or do you not believe in healthcare and science anymore? Why are you not taking the vaccine? And I said, I don't know enough about it. It's not been out long enough. We were seeing a lot of reactions coming in from the beginning of people starting to get the vaccines. I actually worked one of our hospital vaccine clinics when the vaccine came out to healthcare workers. I wanted to see it for myself. I've always been one that's gotten vaccinated. Every vaccine I've needed in childhood, for healthcare, to work, I've always gotten what I needed to get. Flu shot every year, but something wasn't sitting right with me on this particular vaccine. So I worked the vaccine clinic. As an ER nurse, they put me into the monitoring section after employees were getting vaccinated. They had it set up where they were getting monitored for 30 to 45 minutes after receiving the vaccine. I've never really seen that before. When we give a shot in the ER, we'd watch a patient for maybe 15 minutes before they were discharged, but never a 30, 45 minute period and having to take vitals on them after a vaccine administration, especially on employees. So I worked it, and within about 30 minutes of the first round of people coming in, I had 3 people have reactions as far as high heart rate. I had people with dizziness, and I had one nurse develop a rash pretty instantly after receiving the vaccine. So to me, that was my indicator, as well as I'm not really sure I want to get this vaccine. Then as we continue and everybody's getting vaccinated, I see a shift in the ER. I see a shift where all of our patients are coming in with more strokes, more heart attacks, and cancer diagnoses that I've not really seen very much in the ER. A lot of pancreatic cancer, which I've never seen very much in my ER career. We had a lot of patients that were young, healthy, never had any heart history, never had any significant type of health history at all, coming in with full-blown strokes and deficits, life-altering deficits. People my age, people in their 20s, blood clots. Yes, we've seen blood clots in the ER, but to the extent after the vaccine, it's been a magnitude of many people with issues. I've seen 12-year-old boys come in complaining of chest pain, being diagnosed with myocarditis, admitted for observation on their chest pain complaints. I never saw kids come in complaining with cardiac issues. So it's been hard. And then I would hear patients come in, if they'd have COVID, they weren't sick enough to be admitted, but sick enough to get maybe some treatment. I knew doctors were doing steroids occasionally just to help with some of the respiratory and coughing. But I would hear doctors say, sorry, there's no treatment. There's nothing we can do for you. I knew it was not true because I knew we had doctors that would treat. It just depended on what side of the science that they wanted to be on, whether or not they felt like there was a treatment. If we even mentioned the word ivermectin in the hospital, we were threatened. Like, this is your job. We don't use ivermectin. Our doctors were not allowed to even mention that to patients. I've been on ivermectin since 2020. I would tell my colleagues that would give me a hard time over the vaccine, and I would get ridiculed as, you're not a horse, you're not an animal, why are you taking that stupid stuff? It took me 2.5 years to get COVID, and I was in every COVID room, not scared of any patient with it, and I was taking ivermectin prophylactically.
So did you just stay in ER, or did you get into the COVID wards?
No, I stayed in the ER, but we pretty much were COVID wards because we ran out of places to put patients.
So here's what we're hearing on the road.
Yes.
The unvaccinated go to hospital because their pulse thing is telling them that their breathing,
right,
whatever, oxygen's low. Go there, then they test positive for COVID. They then get taken away from their loved ones and put into some kind of COVID ward. They then have a bit of oxygen, maybe, and they start to feel good and they want to go home, but they're not allowed to go home. The unvaccinated, they're ridiculed for being unvaccinated. What that means is not having had the COVID shot.
Right.
That's all that means. And then they, majority of them ended up on ventilators, fentanyl death. And all of when the loved ones get the medical records, it's horrific. It's horrific, and it's all the cost of how much, big money for the hospital. So, did you because we're trying to get to the bottom of this.
Okay.
And this is primarily, I think, what our documentary is for sure going to be about. Because I'm trying to uncover it.
Mm-hmm.
So I know you didn't work on those wards, if you like, but what can you tell us about what went on there? We had one nurse tell us that when you did register the deaths, you couldn't put in a vaccinated COVID death. You could only put in a vaccinated COVID. So we're trying to get experts like you that were there to tell us.
I don't know as far as documenting what they were allowed to put or not. I do know our local hospital system was tracking unvaccinated versus vaccinated on vents. Their numbers were not accurate. They would always put out that it was more unvaccinated on the vents. I had a house supervisor who was like the head nurse of the entire hospital that runs the flow of the hospital that was actually tracking the numbers because she was sick of hearing it's always the unvaccinated, always unvaccinated. They were putting out numbers that it was the unvaccinated, but our numbers of vaccinated on vents were higher than the numbers of unvaccinated. And she was doing that by her own documentation and going back and looking at the vaccine status because we were told to ask that in triage in the ER upon admission. So you're wanting to know.
And we're just trying to find out more really about what you know that really went on in the hospital.
Right.
Like
So
we hear about the remdesivir as well.
The remdesivir, my patients seemed to decline after remdesivir, especially after more than 2 doses. They were putting patients on remdesivir who weren't even currently positive for COVID. They had a positive test result, but you know how you can test positive for up to 3 months typically after having COVID. They would have had COVID, their extent of their symptoms would be a month out. They would still test them in the hospital if they came in saying they just felt dehydrated after, vomiting or diarrhea, or still just felt tired and weak. They would still deem them COVID positive and start them on remdesivir. And after they would get about 2 to 3 doses of that, it seems like that's when they would start and end up on a vent, and that they were taking a turn for the worse. I had a woman patient who I got back in the ER from a fresh trach. She had an emergency tracheostomy done. She had an airway disease that narrowed her airway. She had an episode of this. Came to the ER, went for the emergency trach. We didn't have any hospital beds to put her in ICU, so she had to come back to the ER. She ended up being my patient. I was looking through her orders. She didn't have any family there at the time. She was sedated on a ventilator, and her orders were to start remdesivir. And I was looking, because I got nothing in report that she was COVID positive. So I'm looking through her stuff. She did have a COVID positive test, but again, I had no symptoms, no story, no history that she was there for COVID. She was there for a particular airway disease issue that she had. So when I get these orders from remdesivir, I'm trying to get a hold of the admitting doctor. I'm not getting an answer at the moment. Something told me, don't start this medication just yet. So I'm trying to put it off, trying to get a hold of the doctor to verify this order. I'm trying to get a hold of family. I get a hold of her husband finally, and I said, "Sir, is she currently positive for COVID? Is she here for COVID?" And he said, "No, she had COVID a month ago. She's here because her airway was closing up, and it has nothing to do with that." And I said, "Well, they're wanting to start her on remdesivir, which is the antiviral treatment for COVID." And he said, "No, she wouldn't want that. That's not why she's here. She doesn't want that." So I called the physician and I said, "She's not here for COVID. She's here and her husband does not want her to have the remdesivir." And they were like, "Well, she's positive, so she needs it." And I said, "They're saying no. I'm not administering this. The husband is telling me no, and this is not why she's here. She still has a positive test from being positive a month ago." They were trying to push it, and ended up, first they had to go by what the patient wishes were, so we didn't start it. Antibiotics or anything to go home with, they meet discharge criteria, And I would say, can you please write them a steroid or something to help them? He said, should have been vaccinated. My morals, I had to battle my morals every day. I would sneak cards of local doctors, their business cards that I knew were treating patients outside of the hospital for COVID with antibiotics, steroids, ivermectin. I would sneak patients their business cards that felt like they were left hopeless of no treatment and that nobody would help them in the hospital, so that when they got discharged, they could go contact these doctors to get help.
And you no longer work there?
I do not work in the ER anymore. I couldn't take it. I am ashamed of my career. Not my personal career. I'm ashamed of where healthcare has gone.
Profession.
Yeah, my profession. I'm ashamed of where healthcare has gone. I thought we were here to truly help people, and I learned during COVID that's not the case. And if you didn't go along with the narrative, you were deemed stupid, didn't believe in science, you should not be a nurse. I've been called so many things. But really, I was trying to help my patients. I was an advocate for them. I didn't discriminate whether they were vaccinated or not. I always was there to help them in the best way I could, and I tried to give out as much information and knowledge as I could that I was learning to my patients so that they could make the best decision for themselves. I had many patients ask me about remdesivir. What would you do? What would you do? And I would tell them, you need to research this medicine. I would tell them side effects that I was aware of, but I would tell them it was their choice, that it had to be their decision to make. I couldn't make that for them, but I tried to be the one that gave all the knowledge that I could to them, not just one-sided. Our hospital system even tried to segregate us as employees by our badge color based on our vaccine status.
So what colour meant more?
So it didn't happen because everybody raised a lot of concerns and problems that would result out of that, but they tried to push it very hard. We were going to be orange if we were not vaccinated, blue if we were vaccinated. And it was going to be right on our badge so everybody could see it. Patients could see it. We would say, that's our privacy, that's our personal decision whether we want to be vaccinated or not. It shouldn't be displayed for everybody. And they said, well, all of your coworkers have a right to know if you're vaccinated or not. Your patients have a right to know. But they would also try and say, well, nobody's going to know what that color means. Well, we all have different scrub colors based on our, if we're a registered nurse, if we're a respiratory therapist, an LPN, we had different scrub colors that differentiated us based on our degree, or not our degree, but where we were in the hospital, what we were. And I said, our patients know what that is. You're telling me they're not going to know what our vaccine status is based on our badge color? They're going to figure that out. It's going to be very well known. And I raised concerns about security issues. Patients would wait, if they found this out and they knew I was unvaccinated, they're not going to want me to take care of them. There's going to be patients waiting for me in the parking lot when I leave work to deem me a threat to society. Luckily, they listened, and they made it optional that if you received the vaccine, you could have a special badge that said you were vaccinated. But they didn't make us as unvaccinated wear something different.
What about the mean night nurses we've been hearing about? You probably don't know anything about this being down in New York, but we've been hearing about strange goings on in the night. Bags being tampered with and...
That I'm not familiar with. I haven't heard anything like that. And like I said, we were busy in the ER. We were.
Yeah.
I don't think that.
Well, I think you've been very brave sitting here and telling
thank
us this.
you.
Is there anything else you want to add to this?
I just wanted to say that I stand with everybody who's been vaccinated and who has been injured, and I'm really sorry for that. I stand with people who felt like they had no other option. I stand with those who are proudly unvaccinated and proudly tell everybody that, and stand up for the truth. And nobody should be discriminated against either way, but we need to recognize that the injuries are real and that these are not coincidences that we're seeing in the emergency rooms in our hospitals and the increase of problems that we are seeing due to the vaccine. We need to recognize it.
Thank you.
Thank you.